of the high infection rate of COVID-19 that he was warning us about. The number of infections are climbing higher and the death toll could double. This requires everyone to be alert and cautious. Going out of your home is risky, whether one is going to shop, work, school, or even attending an event. Anything can happen. So what needs to be done during this time? Let's ask Robert Palmer, who is Head of Professional Services and Occupational Health and Service Divisions at Afroteq Advisory. Thank you very much for coming through, Robert.
No, thank you very much for giving us the opportunity to enlighten you on certain aspects.
Yeah, well, firstly, Robert, has it occurred on your mind that, during this time, things are tough out there, people are dying?
Yes, things are very tough. What we'll be doing our side is essentially looking at how we can make the businesses and the schools and whatnot compliant to make sure people are a lot safer and not exposed to COVID-19 as they are.
So what can companies do? Firstly, let's start at the workplace when they have to ensure that, they are COVID-19 safety protocols compliant, and also looking at the necessary safety measures so that they can protect their staff when it comes to the working environment.
Colleen, according to the OHS Act, all businesses have to have an active and up-to-date health and safety management system. And this essentially ensures that the workplace is safe for all the employees and potential visitors to their premises. This is actually gazetted by government. And what they say is companies have to undertake to have a COVID-19 risk assessment done. On the basis of this risk assessment, they produce a COVID-19 workplace plan. The risk assessment really is kind of governed by the OHS Act, whereby they look at the potential hazards that might arise because of COVID-19. And from that follows on your workplace plan. And the workplace plan, a lot of the information there's pretty much out in the marketplace at the moment. For instance, keeping your staff to maintain some form of social distancing. The businesses also need to get a compliance officer or manager who kind of takes charge of the whole process and essentially checks throughout the day that all employees are maintaining the integration of complying with the workplace plan. The companies also need to have a screening procedure or protocol in place that essentially is for all employees when they come to work in the morning, whenever they come to work, plus visitors to the premises. This entails keeping a detailed record such as their name and their surname, taking a temperature reading, which is not above 38 degrees, and also a questionnaire to ask them if they are showing any symptoms of COVID-19. Now the problem is sorry, Colin.
All right. My apologies to interrupt you there. In the interest of time,
No problem.
we are in the peak season, and the safety protocols, how do we ensure that they are foolproof and they are not breached as workers go home where they might be attending events over the weekend and perhaps get infected because they have commitments to go bury their loved ones or go shopping? Any exit from the safety of the workplace and the safety of their homes would pose a risk.
Yes, of course it does. But safety protocols are a very difficult way as their physical implementation. There's no such thing as a foolproof aspect here. All we're trying to do is reduce the risk of catching COVID-19. So the company should really the employer should really follow the company's procedures and protocols. And the company is essentially being governed by what government recommends and the WHO. So they're doing the best that they can under the circumstances for their employees. Also, obviously, updating employees as to what the latest COVID-19 guidelines are, maybe enlightening where the hotspots are and making sure they don't go there. Has that answered your question?
Yes, partly so, because I actually wanted to get to exiting the workplace and going home. Homes are also risky areas because if you are living with your family, children go to school, and your spouse goes to work. When you come home in the evening, you are likely to have somebody who could have unwittingly been infected, and they would know perhaps after 2 weeks. And this would expose you as an employee at the workplace, where you could also not know that you are infected, and you pose a risk for your colleagues as well.
Yes, 100%. I do. As an aside, we've tended to notice that companies that have followed these protocols and explained and done education for the employees, I tend to find that these employees actually get into the good habits of how the company works and take those good protocols and procedures back to the home place. And in doing so, making their family follow the same suit and making it safer for them as well. But as I said, there's nothing that is foolproof here. I wish there was, unless we lived in some kind of an isolation bubble, which is really not realistic.
Right. Just lastly there, your message to the people out there.
Don't panic. It's all going to be all right. It's not as bad as everyone thinks. Don't panic. And don't victimize people that have got COVID-19, because a lot of us, or most of us, are going to get it at some stage in our lives.
All right. Thank you so much for making time to speak to us. Robert Palmer is head of Professional Services and Occupational Health and Safety Division at Afroteq Advisory. Let's take a break. We'll be back after this.